How often do babies get switched at the hospital?
Must have been a lot because they put some serious measures in place. Yes. So,
Thank you so much for joining me, Nurse Carly. I'm so excited. I know people usually love to put like all nurses in like, oh, nurses, but there's really so many divisions and departments and fields and specialties. And I love getting the chance to talk to so many of you guys in different fields. So you're specifically in the postpartum.
yes. And it often gets confused with like labor and growth,
Right.
but we do work very closely together.
Yeah. I didn't even know there was a difference. So like, what is the difference?
So actually in some hospitals, labor and delivery nurses do take over the postpartum role. It just depends where you are. But so if I worked in a bigger hospital that's specifically for women and babies, so obviously we have all the people you need for the different things. The main difference is a labor and delivery nurse is there to actually deliver the baby, or they will go into the C-section and do everything that needs to be done there.
Right. Okay.
Postpartum kind of takes over after the 2-hour mark, after delivery, because that's your like recovery time on labor and delivery. So you get moved to your recovery
After 2 hours.
after 2 hours.
Is there like
Usually
a specific reason for the 2 hours? Like,
It's just to see how you handle
Okay.
recover. Like basically after your epidural, you have to make sure that you can get up and walk, that you can use the bathroom, those kind of things. There's certain like marks that you want to look for.
Okay.
After
Okay.
delivery, and same with the baby too. We want
Right.
to make sure that the baby's transitioning well before they get moved to nest.
So it's not just like a for funzy number. Like there's a reason for the number. Okay. Yeah.
And it's probably helps the hospitals in some ways to make sure we have a room available, that about it stuff. So yeah, but of course it depends on the hospital where you are, what their actual policy will be.
Right.
Built up, but that's probably the standard, I would say.
Got it. Okay. And then so like what is your role specifically like as a postpartum nurse?
So postpartum nurse, and this is probably also a bigger difference between us and
Yeah.
labor and delivery, is the baby becomes our patient.
Got it.
So
Okay.
if I have, we call it couplets,
I like
a mom and baby pair. So my patient is the mom and my patient is the baby for that couplet. And typically we have 3 to 4 couplets in a shift,
Okay. Okay.
and that we're responsible for.
Got it.
So our main job is making sure in the initial 24 hours that both the baby and the mom are recovering, the best they can. We don't have any immediate issues. There's a couple of things we're always looking out for that can be emergency situations. Of course, we're always monitoring for that. But basically just making sure that both mom and baby are transitioning well after birth. And obviously a lot of education hits that first, especially in the first couple hours. They kind of come to the postpartum floor and they're like,
What now?
this is our baby. What do I do now? So we come in and we explain everything you need to know. This is what to expect. This is what we're looking for. Like, just for example, we want to make sure that the baby has their first poop in the first 24 hours, like a big deal on the postpartum floor, things like that. So we educate the parents, if both parents are there, about certain things to look for. And then breastfeeding and bottle feeding, that's a whole other thing that takes a lot of time to, get everybody acclimated to. And then there's a whole list of tests and screenings that get done for the baby before they go home. So
Okay.
those are a big part of the job too.
That how has there always been a big distinction and division between like labor and delivery and postpartum? I just ask because like my mom did the lactation consulting, and like I guess when I was younger and she described it, I never really got it. She's like, "Oh, I didn't like labor and delivery," and I was like, "But you were lactation."
Right.
What do you mean? You loved that. And so like now, like she never really explained what they were doing. She hasn't worked in a hospital in a long time. She still helps out like with whoever with lactation consulting. So I never like thought to ask like, what do you mean? Because as a daughter, you usually just go, Mom. Like
She works with baby.
she works, she does something. I don't know. She doesn't know what she's talking about.
And
But
that's totally okay. And actually, now that you say that, a lactation consultant is its whole other world. Asian, and they have their own thing going.
it's so niche, but like I think that a lot of people don't really understand like the specific education that goes into the specific things.
Yes.
And even it's so funny because like sometimes my guy friends will be like, "What do you mean people have to like learn how to breastfeed?" And I'm like, "Yeah, like you don't get it. Like you don't know. You're not ever gonna know. But like yeah, like it doesn't always go smoothly, and that's okay. That's fine."
Yeah.
Right.
And that's actually so true even for women too that are having their first baby. What do you mean this isn't just going to happen? And it does not just happen for a lot of people. And that's actually like a really hard thing for people to kind of wrap their head around. Like, wait, this actually is not working at all. And now I'm nervous because the baby's not eating. So that's like a whole thing. And that's why lactation consultants are such a godsend in the hospital.
Thanks, Mom. Yeah.
Yeah, I mean, they can really kind of troubleshoot a lot of the things that are going wrong.
I think my dad always used to tell me about how, like, when I was born, and my mom was a nurse, right? It's not like she didn't know anything. My dad, and she worked with babies, and so I was born, and they like took me home, and they put me in my little car seat. Didn't even take me out of the car seat, just kept me in the car seat and put me on the table and looked at each other and went, "Now what?
Yeah.
What? Now what do we do?" And so I think that for a lot of people who are having their first kids or getting ready to have their first babies, like, they don't know what to expect, and they don't know what is considered normal and what they should be looking out for, like, shortly after giving birth. So what are some of those things that you tell new parents? "Hey, you might experience XYZ and that's normal," or, "Hey, you might expect XYZ and that's not necessarily normal, but it happens, and this is just what we're, like, looking for to take care of you." So what are some possibilities?
There are so many.
Okay.
That's kind of how I started my platform, is because of exactly what you're saying. Because I realized in the hospital, every time I had a new patient, I'm like, wow, we're talking about the same stuff over and over. Like,
People don't know.
they don't know, and everybody has the same questions. It doesn't matter what walk of life you're from.
Exactly.
Like, baby, and you're like, what is this? Somebody help me out here. So that's kind of where, I started making these videos. I'm like,
I love
about all these different things that I know people know.
absolutely.
So one of them, going back to the breastfeeding, that's a big one. I want moms to go into the experience knowing this might not work out the first time. That doesn't mean you're done.
No.
It's like the first 24 hours might be great, and then the next day is horrible. And it could be due to, let's check the latch, let's check and see if there's a tongue tie. Like, there's all these things that you can kind of troubleshoot and try to figure out to make things better. And just because the one day didn't go well doesn't mean it's done and you can never try again.
Right.
I think so much with newborns is trial and error, and it's just, you just keep trying different things, because all babies are different. And I do want people to understand that while all babies are different, a lot of things are also the same.
Okay.
There are a lot of things that we can try that will work for all babies.
I love that.
The way they are, it's the way they're wired.
Yeah. Something that I also, and like, I don't have kids, but a lot of my best friends are starting to have kids, right? So like, I get to be fun Auntie Bex, but then I also get to hear my friends, freak out about various things and worry. And I feel like, especially new moms, not only get so nervous about being the best mom that they can be and want to figure out how to do that, but mom shaming is such a real and unfortunate thing. And I know one of my best friends, when she had her first baby, was having the worst time breastfeeding and was just like crying. And she's like, "But I have to figure out how to breastfeed. Like, everyone's gonna think it's like bad if I'm not." And I'm like, "No, but is your baby fed?
Right.
Fed is best.
Great.
Fed is fed. If they're fed, okay.
Yes.
Like, we would all rather a fed baby than a starving baby, correct?
And
Correct.
that seems like such common sense. It's so funny because, like, it's something with being postpartum. It's something in the hormone. When you realize that this is not working, it is like your world is ending. And I have even been there. I had all this experience as a postpartum nurse. I had all this lactation experience.
Yes.
And I knew that there might be an issue with my personal breastfeeding journey.
Mm-hmm.
And even as it was happening, I'm like, what is happening? How could this?
Why? This should be natural. It's not. No.
It's not working. And it was a horrible first week of life. I'm lying alarm because she was starving. I had no idea that I did not have enough milk. I didn't even know that was an option. Like, I didn't think it would be an option for me. I just couldn't like put myself in that position in my head. And then it was happening, and I go to the pediatrician, who's like, well, she's lost well over 10% of her birth weight, and we have to give her a bottle right now because she's starving. Like, this, he said to me. And of course, it's just crushing. You feel so like a failure. You just feel like a failure. But that is first time mom thinking. Because by the time I had my second, I was so much more prepared for the fact that, guess what? I'm probably giving her formula and she's going to be perfectly fine.
And that's okay.
And
that's
she's gonna
fine.
be healthy. And actually, she's going to be better off than her sister was for that first week of life, because she's going to be happy and fed and sleeping. I mean,
Exactly.
the first week was not even sleeping because she was so hungry. Like, how horrible.
I remember another one of my very good friends had her second And she was very lucky with her first, that breastfeeding was very easy, but with the second, it just wasn't. And she wasn't producing enough milk. And she was like, I didn't have this issue the first time. I don't understand. And sometimes people find something that like works for them and they're like, oh, this is a hack, but it doesn't work for everyone. So I want to know if this is something you've actually heard of.
Okay.
Is I think what is it? The body armor
Oh, yeah.
hydration stuff? That's a real thing?
Well, people are talking about it on TikTok.
Okay.
But you are right. It is one of those things that might work for somebody and might not work for another person. And the kind of the whole point of the body armor is just hydration.
Yeah.
And that is a big factor for a lot of people is we are not well hydrated, and then all of a sudden you're chugging all these electrolytes and purposefully drinking this drink. Yeah, now you're more hydrated, your milk supply is going to be better.
Okay.
But if you have something else going on, which can oftentimes be the case, the body armor is not going to solve.
That makes sense.
It depends what the underlying cause of your low supply is.
Oh, it's so fascinating. The body's so interesting, man. It's wild. So what are some other things? So like breastfeeding is one. What are some other things that new parents might experience that is normal, maybe not normal, but can be expected and can be fine, is something to look for, just that no one's surprised?
Right. I would say anything regarding sleep is usually a little shocking to parents, but specifically, newborns make a lot of noise when they're sleeping, and it most of the time is normal. They make these little grunting, like kind of sometimes can sound like they're struggling. Little sporty noises sometimes. And typically it's fine. It's just they're noisy creatures. They have very strange sleep cycles, and their brains are kind of like waking every so often. And that comes with noises and movements and things like that. But what you want to look for, and the big thing that I am always educating parents about, is looking for if there is a problem with breathing, because it can be pretty subtle sometimes. But so I teach parents how to count respirations. If you look at your newborn, you're like, wow, they're really breathing fast. Here's the normal number. You want to look for between 30 to 60 breaths per minute, for example. There's a certain way that babies can be breathing where it kind of sucks in at their rib cage, and that can be a sign of respiratory distress.
Okay.
If their nose is flaring while they're breathing, that can be a sign that they're having trouble breathing. And of course, coloring if they're turning blue. There's certain areas of the baby that are normally blue.
What's blue on a baby?
So blue hands is a common thing in a newborn.
So stressful.
Yes, but if they're blue on their trunk or if their lips are blue, that's bad.
Okay.
So those kind of little things.
I never knew all that.
Yeah.
Because I can imagine as like a new parent being like, well, he sounds like he's struggling.
Exactly.
What's going on? What's wrong?
The DMs and the text messages from my friends that are having babies are like, is this normal? I get videos all the time. So yeah, it freaks people out.
That's fascinating.
Yeah.
Can you think of any other misconceptions that people like new parents might have about parenting, babies, whatever?
Let's see. I think probably with sleep again, I think people think that something's wrong if their baby is not sleeping through the night at a certain point. That's going to vary a lot from baby to baby. It depends, even if you're breastfeeding or formula feeding. Breastfeeding babies might wake up, not all babies, don't come for me, but if you're breastfeeding, the breast milk digests faster.
Okay.
So it is possible that breastfed babies will wake more often than a formula fed baby. So that's one thing. It's just these little differences between baby to baby might affect sleep.
Okay.
There are going to be newborns that might sleep through the night at like 2 months old, and that's okay. But there's most likely going to be babies that are waking every 2 to 3 hours, and you're not doing anything wrong. That's normal. They're wired to wake up often so that they can feed and develop appropriately. So I think some parents feel like, what am I doing wrong? They're not sleeping. You have to be prepared mentally going into it that
you're also not going to be sleeping.
Right. We're not going to be sleeping, but this is what it's going to look like, and this is expected, I guess.
I love that. Well, so one nurse sent me a story, but I have a question before because it goes into the sleep thing.
Okay.
But so hospitals used to have like nurseries.
Yes.
Do they not still?
Yeah.
Okay. Is that less common now, or?
So I can't speak to every hospital.
Right.
I just know what the main thing with the nurseries that people are talking about right now is not putting the baby in the nursery all the time.
Okay.
So that used to be kind of the standard. You would have your baby. I mean, this is way back.
Yeah.
Have your baby, and the baby goes off to the nursery, and mom stays in the room and recovers, and they'll bring you the baby, every so often.
Right.
That used to be a thing. Then they started making the push for keeping mom and baby together as much as possible. So now the nursery does exist for a good reason. There are dedicated nursery nurses that only stay in the baby nursery, and they will help out with tasks that needs to be done because there's a lot that has to be done while the newborn's in the hospital.
Right.
So the nursery nurse is kind of dedicated to certain tasks there. For example, if a baby, sometimes mom does want to be separated for a little bit and be able to rest and recover after birth. So the baby can be taken to the nursery for a short time to do like a round of antibiotics if that's something they needed. Or maybe they want the nursery nurse to do the baby's bath in the nursery. That's an option. The nursery is there for, I would say, probably sicker babies in some cases that aren't sick enough to go to the NICU, the intensive care unit. So it's kind of like a in between for that sometimes. But also it's just there to have extra hands if if we need help with our nursing tasks for the baby, or again, like if mom just wants a break. She doesn't have to take the break, but if you want that option, it's there for a little bit.
Interesting.
Yeah.
Okay. Well, someone sent me a story
Okay.
about she was a postpartum nurse, and it was the middle of the night, and she was on night shift, and the nurse call button was just being like spam pinged in one room, and she was like, "Oh my God, there must be something wrong. Like, I'm gonna hurry. I'm gonna go see what's going on." And she runs into the room, and she just sees, like, she obviously hears baby crying,
Right.
and just sees mom and dad looking angry and frustrated, but not scared. So she like her ease a little bit. She's like, "Hey, what's going on?" "Our baby's been crying for 30 minutes." And she's like, "Oh," like waiting for the question. And she's like, "Okay." And he's like, "You haven't come in here.
Oh gosh.
You, like, I had to sit here and ping the button. You didn't come in here. You didn't hear our baby crying." And the nurse was like, I don't understand what you're asking me." He's like, "Well, you haven't come to check on the baby." And she's like, "I'm your nurse." He's like, "Right." She's like, "I'm not your babysitter. I'm your nurse. This is your baby, your mom, your dad.
Right.
This is not, if the baby's crying, it's your job to figure it out." And they just like looked at her and they're like, "But you're our nurse." And she's like, "Right, nurse and babysitter are not the same thing. I don't know what you don't understand about that,
Right.
but I don't know how else to explain it to you." And he just could not grasp that, like, this was not bedside service. And is that like a common thing?
So glad you brought that up. So this is actually a very funny phenomenon because I feel like, especially like right now, there is such a split. There are the moms that do not want the nurse anywhere near their baby. Like, don't even come in here. I don't want to see it. And then on the absolute flip side, we have the parents that exactly like you just described. Why are you not in here taking care of this baby for us? This is like, isn't this your job to care to be? So I have had plenty of moms, ring the button for me to come change the baby's diaper. And I'm not going to say that there are not cases where that is necessary. Like if you just had a C-section, it is hard to get out of bed. It's hard to bend over into the bassinet. So we're happy
That's
to do
different.
that. But there are cases where you're ringing the bell every time the baby needs, to be changed or to be fed. Like she wants me to stand there, hold on while the baby's like it's breastfeeding. I'm like, I'm not going to have time for this. I have 6 other patients. But like we try, I mean, it's case by case basis, but definitely I have experienced a similar thing.
Do you think, are there any other like misconceptions like that where like people aren't trying to, but they just kind of like make your job a little bit harder than it needs to be?
Yes.
So, okay, I'm ready.
I honestly think specifically in postpartum nursing, we are kind of an ostracized specialty. I hope
Okay.
and I say that because that's just kind of the vibe that I've gotten.
If that's your experience, that's your experience. And if people are upset about that, they can just be upset about that.
Other postpartum nurses will disagree, but
They can disagree if they want.
in nursing that we are kind of like that, oh, you're a postpartum nurse. Like it's not a real thing.
What?
Which can only be said by someone who's never done it.
Right. Yeah. That's wow.
The reason I think it's like that is we are for the most part in the happier side of nursing.
Right.
Nursing, when you think of being in a hospital, it's a horrible thing. Something is wrong. This is the side of nursing where something is great most of the time.
Well, yeah.
There are cases where that is not how everybody feels. But so typically it's a happy experience. We've got happy patients. Everybody wants to be there for the most part. But so hold on, I lost my train of thought on that.
This the ADHD guest strikes again. Oh no.
So yeah, that's typically how people think, or maybe how other nurses might think of it, because it's just a happier feel.
Right. Okay.
But the patients also get a little confused because we can seem like, I guess it's more of like a customer service job, because everybody does want to be there and they're expecting this great, happy Disney World experience, especially in Orlando.
Mm-hmm.
And we do kind of tend to get pushed into more of like a waitress job.
Oh,
So the call button is going, can I have crackers? Can I have juice? Can I have this? Can my friends have crackers and juice and snacks? And where's the menu? And it's just like a lot.
what a menu. I'm dead.
We need, when's the photographer coming? Like, it's that kind of stuff.
People have asked you that?
Oh, yeah.
When's the photographer?
Photographer.
What? Hold on.
Yes.
Oh, okay.
Yes.
What? You have a photographer on staff?
It is a staffed baby photographer, at least where I work, because again, this is
Okay.
for moms.
Right. Okay.
Yeah, there is photographer on staff to do the first newborn photos, and
Okay.
they have props, and they would come in and like there would be a session, and they put like a sign on the door like
Do not disturb.
photos in progress, which is actually really
That is like cute.
but it just adds another I guess person.
Disneyland experience. Yeah. Another question first. How long do moms typically stay in the postpartum wing before they're released home?
So it used to be, I would say the most common was between 2 and 3 days. 2 days for vaginal delivery, 3 days per C-section. Post COVID, and I don't fully understand the connection.
Heard?
But it's more of a push for 24 hours.
Really?
Yeah, and
That's a
a
jump.
lot of times parents will request that too. They want
They want to get home.
if it's possible. So we definitely see more 24-hour discharges, but I would say 48 hours is more common now.
I had a nurse send me a story that after 48 hours, they went and they sent the discharge papers and they're like, hey, just check on any last things that you might need. And the parents just kind of stared at her like, what do you mean? And she's like, well, what do you mean? What do you mean? These are discharge papers. Like, you're doing great. Baby's doing great. I don't see. It's time to go. Like, this isn't a hotel. Like, and she's like, but I thought I was going to at least be here for a week. So that's a long time. Why did you think? Well, I just had a baby. And she's like, yeah, everyone in this wing just had a baby. And but who's gonna help me with the baby? And she's like, you're the dad? Like, I don't know what to tell you. Like, you can't stay here for a week. Like, that's excessive. And she just started yelling and screaming because, like, don't you know I just had a baby? And she's like, ma'am, this is a Wendy's. Like, I don't. Everyone here just had a baby. You're not special.
Yeah, I know. I think so there's two scenarios at play there. It's either she's terrified to go home.
Oh, yeah.
I can't do this. I'm not gonna go without you.
No.
It's maybe a moment of panic.
Yes.
But on the side of that, it could be a sadder situation, honestly. Like I have had patients begging to stay in the hospital because they don't have a good place to go posing. So that's,
What do you do in those kind of situations?
we have resources that we can, refer people to. It obviously depends on location and everything, but typically like social work will get involved and try to help them. But yeah,
That'd so sad.
stay here, and sometimes we can accommodate for another night. It just depends on the hospital, what their policy is on it, if they're full.
Yeah.
Stuff. But yeah, so there's always I think that's a big thing about postpartum nursing is just realizing the different walks of life. I mean,
Yeah.
there that's having a baby, but you never know their story. And that's kind of part of our job is to make sure that our patients have a safe place to go to.
Absolutely.
That they're not in danger going home with the father of their baby, like those kind of things. We have to kind of almost be like little investigators at times.
Yeah.
Picking up on the cues.
I'm sure a lot of people don't even realize that's like a big part of your job.
Yeah.
Can you think of any other things that you do that general public may just not understand is like really important, but also something that you do all the time that's kind of like underappreciated, unsung heroes?
I mean, probably along those same lines, just having to report if something is wrong, like if
Mandated reporters.
yeah, we're managing reporters, having to sometimes we will have to put in the calls for like a social worker to come or someone else to come if without kind of talking about it with the patient, if that makes sense. Like we've picked up on something and we'll send somebody else in to see if they can get more information because they don't always tell the nurse what's going on. Yeah, it's kind of you always have to be on. You always have to be looking for things so that you don't miss something dangerous that could happen.
Absolutely.
Especially when it comes to, just the care of the baby. Because there have been times where I've picked up on some red flags, like maybe this is not a safe situation for the child. So yeah, that part of it is that's not fun. It's not roses and butterflies. It can be sad. It can be really.
Oh my gosh, yeah.
And I think that's the
Yeah.
thing is people think, like I said, like they think of you, oh, you work with babies, that's so fun and happy, but there is such a sad side to it.
I feel like with postpartum nursing, the highs are really high and they're the most typical, but the lows are bad, like really bad. And like that's a lot of nursing, but
Mhm.
for real with
Yeah,
postpartum,
as I feel like other specialties in nursing might not have those high highs at all, so you don't really get used to that. But when you're so used to seeing this happy family going home and they're so overjoyed to have this baby, and then your next patient is like, I don't want this baby, or I'm not taking care of this baby, or the dad is like, in there being horrible to the mom. It's like, yeah, there's polar opposite experiences in one shift.
that's actually, and I told the story before, and everyone was very invested. I actually told it to Jen Hamilton, when she came to my house and we did more on labor and delivery. But that's what got my mom out of labor and delivery and into lactation consulting, was experiencing a teenager who got kicked out when she got pregnant and was couch surfing on her high school friends' couches, but the baby wouldn't latch and had jaundice and was just crying all the time, and so she tried to return the baby, but this is before safe haven laws. So there wasn't really an option that my mom could give her other than, "Hey, I think this will help the jaundice," because there, like, legally was not anything else she could do at the time, which is so devastating, and so that's what pushed her into lactation consulting. She's like, "I don't care if I'm working or not, if someone needs help, I'm gonna help them." It's like, even to this day, like, when my friends get pregnant, I'm like, "Just call my mom. Just call Michelle. It'll make her whole day."
I assume I will be that mom.
It's helpful. Like, it's I think it helps a lot of people who are expecting to know, like, even beforehand, there's someone who can be a resource and is available and is around and does care, especially when it's someone they know personally. That I think that makes so much of a difference. I have a question, and this might be a really silly, silly, dumb question.
There are no dumb questions.
You say that. How often do babies get switched at the hospital?
I don't know how often it was happening back in the olden days, but it must have been a lot because they put some serious measures in place. Yes. So I worked at 2 hospitals and both of them did some lying. But so now we have matching wristbands for mom and baby. They have a code on them.
Oh,
Every single time that the baby is brought to the room, we have to read out loud the mom's code and the baby's code to make sure they're matching. Every time the baby leaves, you have to verify codes and tell the mom where you're taking the baby, and taking the baby out of the room. The baby has an alarm on their foot. Yet for that, the entire floor of and if that baby goes anywhere, everybody knows. So what? Nobody can take the baby. We cannot give you the wrong baby. It's like very foolproof at this point.
that's what's like, it's so funny because there had to be a problem.
Oh, yeah.
For such.
I think actually, now that you say that, when I was training at one of these hospitals, I'm almost positive we had to watch a video about a baby that got switched
On purpose?
to help it. No, like that
Oh.
it was an accident. They gave the wrong baby to a patient, something like that, or the baby got stolen. It was one of those, and they made us watch a whole video just to know how serious we are about matching the code.
That is crazy.
Yes, not a scenario anybody wants to be a part of.
Can you think of any scenarios in which, like, maybe even again, because we every episode I always talk about, there are always people in every profession that don't need to be there.
Oh,
What are some ways that other nurses have made your life more difficult? Nurses, doctors, whatever.
Oh, well, I will say I feel like I've been very fortunate in
I love that for you.
experience. Like I really have very little negative things to
That's
say,
so good.
especially about my coworkers.
We love that. We love
I've
that.
worked with some of the most amazing people, amazing nurses, like
That's beautiful.
just so kind and so helpful and dedicated to what they do. And that has helped me, of course, shape me into the nurse that I became. And I'm so grateful for those people. But there's one in every crowd. So I definitely had at least one coworker that was just, it's not even like that they did anything to make it more difficult, but they didn't have that same kindness.
They weren't there for the same reasons. I won't even say right reasons. I'll just say same reasons.
Or maybe it was more that because at the time I was a new nurse and, learn so much to learn, so many questions. And I'm sure that's annoying as a veteran nurse. We call them veteran nurses.
Like we do with the veteran teachers too. Yeah.
So, and thank God for these people because they do teach us.
Oh, absolutely.
So I can see how, a new nurse for the 100th time asking the same question it can be, challenging for them. But I think it's important, in your workplace to always just try to be kind to everybody.
Absolutely.
Like they deserve to be there kind of thing. Doctors, it will always depend on the doctor, but there's definitely ones that are terrifying. I mean, doctors that you trying to kind of go to the other side of the hallway so you don't have to pass them and talk.
It's one of my uncles. Oh gosh. He just like appears terrifying.
Yeah.
He's like 6'3". He looks like he could belong in the mafia. Like he doesn't really smile. I used to be scared of him as a child. He's a neurosurgeon.
Oh, well.
Yeah. Yeah, you know the type.
Cardiac and neuro, I wouldn't be able to speak to you.
Yeah. And then, but I love trolling him. That's like my favorite
Probably
thing.
makes it better to have a family member that you can kind of.
Oh, when I was a kid, I was terrified of him. But as an adult, no one trolls him harder.
Right.
Nobody trolls that man harder. I literally, and my aunt always says, Udi always smiles more when you visit. And I'm like, I know. No, Udi smiles when I visit. No, don't give me more. He doesn't smile on a general basis. But anyway, yeah, they're terrifying. Absolutely terrifying.
I did just think of one thing that is a core memory from one of my.
Oh, I'm ready. Oh, please tell me.
And technically my coworker, it wasn't a fellow nurse. It was someone on the housekeeping staff.
Okay.
And I was still a nurse and I was on night shift at this time, which night shift for me, night shift and I, not friends.
Oh, no.
It just like it heightened my emotions. I was just,
Night shift is different. Night shift is different.
It's a different life. A lot of benefits to night shift, but it's hard in its own ways.
My former mother-in-law was a night shift psych nurse.
Oh, wow. God bless.
I understand. You don't gotta tell me. I know.
Yes, that is a lot. But I just remember, I don't exactly even remember like what prompted this to happen, but it was the very end of my night shift. So the morning or the day shifts had come in. I was getting ready to hand off my patients and I had left an IV pole in one of my patients' rooms. And typically when the IV medication is done, you're supposed to clear it out and we have like a pod that it goes in. And so the housekeeping staff had gone in and I had left the pole and she came out and she just like, she found me. She found that I was the nurse for that room. She just berated me in front of like a group of nurses. Just let me have it about the fact that I left this pole and I need to take it to the closet. I think she called me some names and said I was ungrateful or something like that. Like she must have been having a very bad morning. I'm gonna give her that. But I lost it. Like I went into the break room and sobbed my eyes out for like 30 minutes. The other nurses were coming in and they're like, it's gonna be okay. Don't let her take you down like that. But it was just kind of like a random, like, why me? Why did you choose me to?
That's so like wild because as a new nurse, you're still learning. You're learning the procedures. It's okay. Just let them know.
Getting to it, I wasn't gonna leave it.
Yeah,
I was gonna go get it before I went home.
how long was it left there?
Oh gosh, not long. Definitely not long because I had just finished it. Yeah.
I'm so sorry that happened to you. That's so sad. Can you think of any other stories, whether it be with other staff, patients, whatever, where you just thought like, oh my God, I don't get paid enough for this?
Well, just in general, like the workload can be so daunting sometimes, especially if you work on day shift. Night shift can be tough too, but it's just a
different reasons. It's tough for different reasons.
Yeah, I mean, most of your patients are typically sleeping at night, but day shift, I mean, there's just the task list like doubles. And especially in postpartum, like I said, we have six patients. It's a lot of people.
Yeah.
So it's a lot of tasks if you are thinking about this task list times 6. So there's just times where I'm like, how am I as a human being supposed to physically complete all of these tasks and have the time to sit down and chart out all these little tiny things that have to be charted or I can't go home. Like that's the kind of thing that just can be, really weighing on you as a nurse.
You hit pause on time.
What?
You hit pause on time. That's how you do it. You pause the universe. Then you can't do that. Oh, I'll get you a remote, you know?
Just for that button?
Yeah,
That seems like
I'll send you the Amazon link to yeah.
yeah.
This is, like, such a bad joke, but, like, it's such a I you laugh so you can't cry. So, like, I grew up in a Jewish household, and I had a I had a friend who, we always go to trivia on Wednesdays, and I was like, "Hey, do you wanna go this week?" And he's I can't, like, I'm so stressed out, blah, 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 like, I just have so much going on, I'm not gonna be able to do it th and I'm like, "Okay, like, yeah, is there anything that I can help you with? Like, can I be of any assistance just to, like, take some stress off you?" And he's like, "Oh, do you wanna add a couple hours to the day?" And I was like, "Oh, I mean, my people, we already control the weather, but I'll see if we can add it to the Zoom call agenda, like, just we'll see what we can do." And he it was a bad joke, but he really enjoyed it. He's like, "Okay, you're not usually funny, but that was funny." It's like, I can be fun they don't think I'm funny, it's fine. My brother doesn't it's thank you, I appreciate it. I'm like, "I think people disagree, but that's okay. If you don't tell me otherwise, it'll hurt my feelings, I'm sensitive." Anyways, what is your favorite part about your job?
I think favorite part about being a postpartum nurse is for me, like as soon as I started to really get a handle on the education piece of it, I kind of realized that that's what I'm good at. And that was such a great feeling for me to kind of realize this is why I'm doing this because there's so much education, like you talked about before, like you're literally teaching brand new parents, this is your new human that you're taking home. Here's everything you need to know. And there's actually a packet of papers that we're going to send you home with that you're not going to have time to read. So my job would be to come in and basically break it down. I'm summarizing everything that's in this packet in a very short amount of time.
Right.
This is all the most important things you need to know, not just for the baby, also for mom, because there's a whole bunch of things that can happen to you that you need to be aware of so that you know if you need emergency care or something like that. I just love that part is the teaching and getting to answer their questions. And it felt like kind of a privilege to have the time to do that because I wouldn't get to do it as much as I wanted to because of having some patients at a time. But I really gave that my best effort, right? To try to educate and at least answer some questions, before they go home. That's when everybody's feeling the most anxious, I think.
What are some of the most important things that you summarize that are on that packet?
So for mom, it's the signs of infection or a sign of what's called postpartum preeclampsia.
Okay.
A lot of people don't know that that's a thing. Have you heard of preeclampsia in pregnancy?
I've heard of it, I don't really understand what it is. I know that my cousin had it, that's all I know.
It is increasingly common
Okay.
now. I feel like I'm just seeing it a lot more.
Okay, is there a reason? Like
It's still cause unknown. I think
Okay.
we're getting closer to figuring out what's going on.
Okay, that's good.
It could be related to the placenta, like a reaction, but they don't know for sure. But it's basically a disorder of blood pressure, and it
Okay.
can lead to seizures called eclampsia. So we always associate it with pregnancy, but people don't know going home, it can develop postpartum. And that's even becoming more common, I think, because people maybe are getting more aware of it. But so there's signs to look for severe headache, blurred vision, pain in your abdomen, sometimes vomiting. So those can be signs that your blood pressure is getting too high and you should have it checked out. You should go to the emergency room. And then with baby, it's a fever or a temperature of 100.4 or higher is considered a fever in a newborn. And some people might not know, but a fever in a baby under 3 months is always considered an emergency. Like
Okay.
they have to be seen because
Okay.
infection in a baby that small can really escalate quickly. And then we educate about like the breathing or signs of respiratory distress, like we talked about. Big one going back to breastfeeding again, or just feeding in general. If people are not feeding often enough or enough at a time, then we have to be looking for number of wet diapers in a day. So one thing that we teach parents is that the number of wet diapers should match their days, their age in days old.
Okay.
So on the first day, we're looking for that one wet diaper. On day 3, we're looking for at least 3 wet diapers, and it goes all the way up till 6 or 7. It kind of like taps out at day 6 or 7.
Okay. Okay.
So that's an important thing for parents to be looking for to make sure your baby is getting enough nutrition.
How often does a newborn eat?
Every 2 to 3 hours is the minimum.
Wow.
So that comes out to 8 to 12 times a day. And so if they're bottle fed or like formula fed, it's going to be closer to every 3 hours. Breastfeeding can be they can go through what's called cluster feeding. And that's when if that baby is crying, they're probably hungry, and it doesn't matter if they ate 30 minutes ago. They need to eat again. So especially in those first couple of weeks when you're establishing breastfeeding, it can truly seem like a full-time job. Like you are feeding around the clock sometimes. It just kind of works out that way for some people.
That's so interesting.
Mm.
Do you have any specific advice that you would give to new parents?
Right now, something that's been weighing heavily on me,
Okay.
just in the age of the internet that we're
Right.
in right
Yes.
now, I am just seeing so much misinformation, and I'm talking dangerous
Oh,
misinformation.
like what?
I don't know I don't know what's going on, but there are accounts that of people just like normal everyday moms that have decided they're going to start giving medical advice on the internet.
Oh,
Maybe their only credential is that they consider themselves to be like in wellness, like, you know what I'm saying?
yeah, yeah. Air quote. Yeah,
Minded, let's
yeah.
call it. So I'm seeing a lot of just kind of things that they don't have research and evidence to back it up. And I'm so big on that. Like everything that I share, I'm trying to come from a place of we have research that has shown us that this is why we do this. This is why this is safe, you know, that kind of thing.
Okay.
And I'm seeing things being spread. Like the other day, I actually share on my story because I was so upset about it. Someone had, I think she was a physical therapist, and she so not a doctor is my point. I, yeah, and she shared something about it's a haunted house, but the hospital calls Child Protective Services because you declined every newborn procedure. And the reason that makes me so upset is because you're insinuating that moms should be declining things at the hospital. Like we're giving this kind of tone that everything done to you at a hospital is negative and bad and has bad intentions and bad outcomes for people. And it kind of blows my mind knowing what I know.
Yeah.
Like, how do we get here where you think that you should decline life-saving procedures? For example, kind of ballsy to even
No, I'm ready.
your comment section might go.
That's okay. That's okay.
But so there's something called a vitamin K injection. Have you heard of that?
No.
So it's this one-time shot that's given to a newborn right after birth. And the purpose of vitamin K is it's a clotting factor, basically. And it helps your blood to clot so that you are not internally bleeding and dying.
Right.
Newborns are not born with the appropriate amount of vitamin K yet. So we give this one-time dose of vitamin K to help their blood clot so that they don't experience what's called vitamin K deficiency bleeding, BKDB. And that can lead to brain bleed, brain hemorrhage. That can have, obviously, severe consequences like death, but also brain damage. Parents are declining this more and more and more. First of all, they think it's a vaccine, and you know how people are about vaccines right now. So they're declining this shot. And what's the reason? Because they read something online where somebody said it's poison.
Oh,
Or it has a black box warning is the big one that I'm seeing right now in my comments.
what does that mean?
A black box warning is on the side of the medication when you pull it out. Like if you have a fresh box of vitamin K injection, it has this warning that it can cause death. Something I don't have the exact wording of what it says, but it's the whole point of a black box warning is for the medical provider.
Yeah.
Tell us, stop, if you give this in a different way or in a different dose, it could lead to death.
Or hey, if you give this in a way it's not supposed to be used,
If you
this
do
is bad.
you're going to kill somebody. That's
Yeah.
the black box warning. And people, that's like the number one thing people are saying in my comments that when I talk about this. There's a black box warning. I'm like, yes, I know it's for me. It's not for you.
Just about everything that can go into your body, whether it's food or whatever, if used too much or at a wrong time or whatever.
Dose makes the poison. If anybody's ever heard that quote, it's so true in nursing medicine.
Well, anything can be used as a black box warning.
Right.
Peanuts put in the wrong person.
Yes.
It's gonna that doesn't mean peanuts are bad. It means you don't give it to the person that can't have peanuts.
Yes. And it's just, you know, it's a frustrating place to be a healthcare worker in
This day and
this
age.
day and age. But the thing about the vitamin K is I talked to a pediatric resident, and he said, you know, what's so crazy is we're seeing more and more admissions of a little bit older babies. So everybody thinks that we're giving this vitamin K for the newborn phase. The effects of not getting it can last up to 6 months old.
Wow.
So he said that they're seeing more admissions of older babies that did not receive the vitamin K injection, and they have that internal bleeding, and they come in, they're brain damaged, and the parents at that point begging, give me the vitamin K, give the baby the vitamin K. Like they realize the mistake, but it's too late. So
what does that mean for those kids?
they do everything they can, but I mean, they have like cerebral palsy and lifelong brain damage if they survive.
Oh my gosh.
Yeah.
Oh, that's devastating.
So that's why I'm pretty passionate about making sure that people understand that you need to look at your source and where you're getting your information from. The number one person that you should be talking to about any of these medical decisions is your OBGYN provider, whoever that is, and your baby's pediatrician. If you read something on the internet, print it out and take it to them and say, what is this? What is the basis of this? Like, is this real? Let them explain it to you. They have the training and the experience, and they want to talk to you and ease your fears about these things. Like, we should not be taking a meme that somebody wrote about vaccines or newborn procedures and say, I'm going to make life decisions based on that.
Well, like, what's even like, first of all, even though they're not a doctor, like you're in the medical field. You understand that nurses are mandated reporters. Even like as someone else who was a mandated reporter, it is always better to report so that we don't get another Gabriel Hernandez situation. If there are people who are declining procedures that are typically wanted by parents to save their kid's life, it should raise flags of, hey, we're just going to make sure these are the right intentions. Why would you not want, because you know if they didn't, the same exact people would be yelling, well, why didn't you check?
Right,
Well,
right.
you should have known. Well, why didn't you help this baby? You let this baby go to an abusive household. Like, there's no winning for mandated reporters.
Very true. And I think the other thing is it's so like, I guess people don't think about this, but like nurses and doctors, like a lot of us are parents.
Mm-hmm.
Families. I've done all of these interventions with my children because I understood what the effect is if I didn't. And I understand why we do it. And I understand that people don't know the whys behind everything and that gives them pause. That's fine. But to think that every nurse and doctor has these bad intentions and like, what are we like going to work every day? Like, I can't wait to mess up somebody's baby.
No.
Why would we do this? I mean, we're trying our best. We took a pledge to do our best and help people, in the way that we know how. And it's really like hurtful that
Yeah.
people have lost this trust for medicine, and I get there's a lot that's happened, but it's tough sometimes to
Yeah.
think that people ask me all the time, how much are you getting paid by the vaccine companies to talk about this? I'm like,
None? That's right up there with like me controlling the weather. I mean, it's fine. Like I'll add it to the Zoom call agenda. It's totally fine. I feel like there's just such a mistrust for the unknown these days.
Yeah.
But at the same time, there's also a laziness of not willing to look into things. And those don't go well together.
I think even worse than that is people, like if I see the comment, do your research. But this triggers me in such a major way because I have 2 degrees and both of them are based on doing research. I really know how to do research, but most people don't. It's actually kind of hard to interpret real research. And so when I see that comment, I'm always like, click, like you read a blog post. That's not research. That's not interpreting research results. Like there's a lot more that goes into that.
But that's why that question triggers me. Because as a social studies teacher, a high school social studies teacher, these teenagers that are commenting, do your research. I've seen them attempt to research. And it's so bad. It's so bad. They're either copy and pasting full articles, not even like bothering to summarize themselves. And I'm like, you can't even prove to me you understand what you read.
Right.
Because you just copy and pasted. Or they're like so far off the mark. Or they're like,
They read it and it's like
that's not,
they're not.
those are not the same things.
Right.
So like when I see teenagers on the internet, like, do your research. Do you know how to research? Because I have physically had to teach 16-year-olds how to research, and that's a pain. I hate it so much. It's such a problem. Okay, are there any last misconceptions, tips, words of wisdom, stories, any last minute things that you want to share that you think are important to end on?
I think just for first time moms, like going back to what I was saying about the misinformation and stuff, it's really a scary time, I think.
Yes.
For people to become first time parents. And there is so much information out there. Just be careful and understand, like I said, where it's coming from. The most trusted people you can talk to are going to be your doctors. Do that, please. If you have these questions, your doctor should be willing to talk.
Right, for sure.
I mean, come on.
Yeah, if they're not, maybe get a different doctor.
Yeah, exactly.
Just get a different
They're
doctor.
not comfortable with what
Right.
they're giving you, okay?
And that's okay. If you need to switch doctors
Yes.
a couple times, that's fine. Like, your doctor needs to be a right fit for you, and that's not always gonna be the first professional you come into contact with, and that is okay.
Yeah, you need to have that comfort where you can have these harder conversations and to learn from them, whatever it is. So, I think just understanding that there is too much information out there right now. But I think in general, like, just don't overthink it, because the first time is so scary, but also you need to trust yourself because you do have those maternal instincts. They're gonna kick in, I promise. It seems like it's impossible, but you are going to always be putting your baby first and doing what's best for them. And um like, you can do this is my point. Like, you can do this. You're gonna do great. It's all gonna be okay. Don't overthink the small stuff. If you have to give formula, it's gonna be okay. If you have to, swaddle or not swaddle, it's gonna be okay. Like, just know that you're gonna be okay.
I love that. Thanks so much for hanging out with me today.
This is so fun.
This was so I literally learned so much. I'm not even, like, having a baby. I've learned so much. I hope you guys loved Carly as much as I did. I learned so much, like, honestly. I'll have to call you one day if I ever decide to have kids. Thank you guys for hanging out with us. I hope you have a great rest of your day, and we'll see y'all next week. Bye, my lovelies.